Tuberculosis in elderly populations. Tuberculosis in the elderly population often presents with fewer symptoms. Symptoms of active TB are nonspecific and less pronounced in the elderly. Difficulties in diagnosis. Tuberculosis in older adults has been assessed in a meta-analysis of studies focusing on tuberculosis in older adults, which found that common symptoms used to identify tuberculosis such as dyspnea, shortness of breath, hemoptysis, coughing, blood and fever are less prominent in older than in younger adults. Classical symptoms of TB, cough, hemoptysis, coughing, blood, fever, night sweats and weight loss, were less common among older patients with pulmonary TB, PTB. For those with PTB, chest radiography findings showed that cavitation and lymphadenopathy were more common among younger patients. Conclusions: older patients aged greater than 65 years with TB had fewer classical clinical and radiological presentations of TB, which may explain longer times to starting treatment from symptom onset compared with younger patients aged 65 years. TB in the elderly presents with fewer of the classical symptoms of TB, less specific radiological changes, and it has even been proposed that TB in older adults should be considered as a different disease entity. By and large, elderly patients feel less discomfort with tuberculosis than are younger patients. This changes dramatically as soon as standard chemotherapy is initiated. According to our findings, there is an increasing risk of TB drug adverse events when age increases. In previous reports, the occurrence of any major side effect has been associated with age, especially amongst the elderly. The frequency of adverse reactions has shown to increase in a progressive and direct form in relationship to age. It appears that in elderly patients, the definite discomfort of the tuberculosis disease really sets in as soon as the treatment starts. But it is safe to assume that public health institutions and physicians are more concerned about containing TB in communities than the comfort of patients. Public health institutions advocate aggressive pharmacological treatment of tuberculosis in elderly patients not because it would add to the quality of life of elderly patients but because elderly patients on a highly toxic drug cocktail are less contagious.